Hello and welcome to episode 43 of the Fertility Rewire podcast. I hope this finds you well, wherever you are and what circumstances are with you at the moment. We're still in our lockdown here in the UK, and I know that's the case for many of you all over the world. And so I just wanted to send you my love, my thoughts, and my best wishes. In this episode, I had the great pleasure of chatting with Ravid Israel. Ravid had quite a journey herself in terms of her fertility and what she experienced and went through, which she will explain. And what she developed during this was a specific app to support those going through IVF treatment in terms of them being able to collate their information and monitor to some extent, not necessarily, but to collate all of that information. So it's all to hand. And what I really liked about it as an idea was how then that information can be shared. And rather than being overwhelming, which I know constant monitoring and Excel spreadsheets and such can be, actually it can be incredibly empowering and supportive to the people who are using it. So I really hope that you enjoy the episode. Information about where to find Ravid will be shared in the episode. Hello and welcome to the Fertility Rewire podcast, a place for information and discussion around topics relevant to fertility. I'm your host, Kat Stevens. I'm a fertility coach and founder of the Fertility Rewire program. And I'm passionate about people being given sufficient information to enhance their own fertility awareness. Super. So I'm really excited to be interviewing somebody that I think is going to have some really useful information, particularly if you're going through assisted fertility at the moment. And her name is Ravid Israel, and Ravid is the founder of the Embie app. And I'm going to let Ravid say more about this, obviously. But the Embie app, in brief, it's the first app that's been created to track your fertility through your assisted fertility journey. Is that right, Ravid? Have I said that right?
Yes, it is. So we help any women going through IVF or IUIs, anything that's any sort of medically assisted trying to conceive. We're there to support you through that.
Okay. And tell me why you developed this app. Where did that come from? I know it's a long story, but tell me, give me the...
in brief, it's I went through my own journey and I saw something that was missing. I'm very much a person who likes everything organized, and I was using Excel sheets and different apps and my calendar and your regular ovulation apps, all of these different things to kind of track what was going on with me when I first began my journey with egg freezing and then through IVF. And I realized that there was hundreds of apps for women trying to conceive naturally, but nothing for the women who were going through treatments. And, in the UK, we're 1 in 6. In the world, we're about 20% of the population. And so how can this 20% be ignored? And so I thought that we really needed something to help us. And that's how Embie was conceived.
Oh, brilliant. And so I love conceived. That's fantastic. It's interesting you said there about your Excel sheets. And obviously when clients are coming to me, that's something they can often show me, these Excel sheets of everything that's going on, which blows I'm an organized person and I do like my ducks in a row. But I'm often my first kind of thought is, oh goodness, this is just consuming, is it a need to be in control, or is it a need to just know what's happening? How would you explain the need for the Excel in the first instance?
So for us, there is probably an underlying tone in my personality that's about control. But from a practical standpoint, where I got my eggs frozen and then eventually moved, I came to Israel to freeze my eggs. I used to live in the States, and they were using paper and pen and fax machines to get data between the doctor and the labs. And so I thought, like, who does that? I've been in digital marketing for over 20 years. Like, who's doing this? And so I needed to create something that was more digitalized for me, that I can track everything that was going on instead of just writing it on a piece of paper. So it came more from a practical place. But then as I started going through more and more of these treatments, it really did become a place of where I could have control. I could have like formulas of dates and what probability of which date am I going to have my egg retrieval on, and when will I get my two lines, my big fat positive, my BFP. It was all of these things that were definitely a part of it, and then eventually graphing it against each other to figure out what the best protocol for me was.
Ah, fantastic. And what sort of information were you, so you were entering it yourself based on the information that you were given or going through with the clinic. Tell me a little bit then. So let's imagine that somebody is going for IVF. They've been for their consultation. It's all systems go. They know roughly what's happening, and they've had their sheet of paper, as you say, that tells them an idea of what's going to happen. They get the Embie app, so they start off and they get the Embie app. What do they have to put in, and then what will it give them?
So currently, we're a tracking app where we're able to, you can take your labs, your medication, your appointments, your ultrasound results, and also your diagnosis, and you put it in, and it kind of lets you chart against previous cycles. It can tell you, on average, on this day of this cycle, you usually have these many follicles, and this time you have this many. So you can kind of see if you made changes in your protocol with medication or dosage, if it's working better or not, or working a little bit slower. Can you advocate for yourself to make adjustments based on what you're seeing? Right now, we're not giving advice, but we are working on an algorithm that is going to take that data and that diagnosis information that you have and say, okay, you are a woman between 35 and 38. You have severe endometriosis. Here is what works on average for the other 1,000 women that are in our database that have this, and create an algorithm that can help say, this is the protocol, this is the medication, these are the things that we're seeing that are working better. Because that's our hope. Like, our mission is to be able to make you have to go through less treatments. I went through 6 myself, 7 egg retrievals, but 6 IVF cycles to have my baby. And so that should, what if that could happen in 3, if I had this type of information and access to it? So what we're doing is we're creating this central database versus, like, right now, every clinic has their own data and information that they use based on their own clients. Now we're going to take some from all over the world and create more of a centralized database to be able to give these recommendations.
Oh, that's fascinating. I had a moment of trying to get my head around the technology there, but that's incredible. And I was just thinking, I was thinking of a client came to me, and we were looking back over past IVF procedures and protocols. Stuff that's really interesting to me is what was happening with the lining. What was your thickness of your lining after your downreg bleed, and what was the thickness of your lining before? And often people don't know that it might just be said in passing, but I guess if you've got that, it's going to prompt you. And I think I'm coming from a therapist angle, and we were talking earlier about therapists and NLP, and I know that you're a certified NLP practitioner yourself. And I was just thinking about, for somebody who is already there with that A-type personality, who is already wanting to have all this information and to use this information, this is brilliant, but it's not really going to support someone who perhaps is quite easy to just go with the flow through everything and hand over that trust, which, I'll be honest, is a very small percentage of people on the fertility journey. But I love the aspect. I think that if they want that, it's there. Sorry, go ahead.
Yeah, I was going to say that what does happen with infertility is that it is completely out of your control, right? And so sometimes even the woman who is a little bit more passive and doesn't need that control on a daily basis, she's going to want to have something to hold on to where she does feel like there's something I can control. I can control being able to put in this information and seeing pretty charts, and I can control like getting the support and asking the questions when I do see that there's something that's different than what I saw in the last cycle, just because it's a little bit more visual and you don't have to see it on an Excel sheet, for instance. You don't have to do this analysis yourself. And so, it comes in handy. You're a premium member, you can download a report for the cycle. So it comes on like a 1-pager. If you ever get a second opinion, everything is right there for you. You can easily go through your history. You can easily tell them what happened in your previous cycle so that that a doctor can give you a recommendation without having to call your old clinic, I know a lot of women that are going through a cycle right now and are waiting for their second opinion appointment. So you don't have to feel bad about that second opinion calling your old clinic for your medical information, because you have it right there on your phone.
Yeah, that's really what's standing out for me, is that ability to share it with others. So it's not just about what you're using it for yourself and what it's giving you. And I think what I always talk about is a sense of control. You're not fully in control, but you've got that sense of control. And then you develop a sense of trust and move on. And I think I can really see its power there, definitely. But I love this idea of being able to share. So I've got 2 or 3 clients at the moment that are in the process of moving to a different clinic. And they're in a real worry about what information will be handed over, and will they know that, and will they know that, and will that be carried forward? And I think that move is really igniting a sense of a loss of control in a lot of these clients, because we were gaining a sense of control, and now they have a sense of a loss of control. But they've got that again, haven't they? They've got that. They are not going where they're sitting with the doctor who's flicking through papers and saying, oh, I see that this happened and this happened. You can say, but what are your thoughts on the lining? Because it wasn't very thick. And what are I do see how that can make you feel, I think empowered is probably quite a key word there.
Yeah, there's empowerment, and there's having the information to advocate for yourself. If you're going to another clinic for a second opinion, you've already taken that step. So here's another way to feel like, I know what's going on with my body. I know what's going on with my care. Because let's face it, a lot of the women who get to this point, it's because there's been a lot of neglect in their care. For me, for instance, I've been to 6 different clinics. I've done rounds with 3 different REs. I was always looking for that next thing. I knew that there was an answer, just maybe this doctor didn't believe in that type of philosophy or didn't take this particular test. And what's really great about the app is that we have over 200 diagnostic questions that we ask. And so, and it takes you through the process based on what you choose. But if you ever choose to just like look and take a peek at, okay, well, what does the testing look like for male factor infertility? Or what does the testing look like for endometriosis? What can I do? You can take these questions, and even though you're not filling it out because you don't have it, you can see what could lead you to perhaps getting a diagnosis that you don't quite know yet.
Yeah, and I'm thinking that saves people, because the big thing that I'm working with people a lot of the time is they are so overwhelmed by Dr. Google and opinions and forums and this information and that information. So it seems like it could be a really nice support in that sense. For sure. How has it been received by the different clinics when people, do you have, I mean, for yourself, I know, but
I made a decision. You mean like how the app is being received, or how my information was being received by doctors? Because I think those are 2 different things, right?
Yeah, I'm thinking more if you turn up and you open your app and say, right, well, that, and you have it all to there. What's been that reaction, first of all?
Okay, so there's doctors who really welcome the information, and you being able to have that kind of conversation. When I did have a partner, I used to remember he told me that he would feel left out of the conversation because I almost became an expert at what was going on, and I would talk to the doctor like I'm a doctor. And so there became like a level of respect between me and my caretaker when it came to what we were doing. By the time I got to my last doctor, we actually created my protocol together because I could tell him exactly which, it's like menopause. My body loves it. I only want that. I don't want an FSH. Give me that from the very beginning. And that's what we did. And we learned through because I also did alternative medicine that, okay, when I use herbs for blood flow, I get better egg quality. And so he was like, all right, we'll do the Western medicine type for that. We'll give you a blood thinner. We created a protocol based on all of these things that I learned about myself through the process that I was keeping a record of. And so there's going to be doctors who are really open to that. And then I did have one doctor who wasn't, who I did my 5th round with, when it was the worst round I'd ever done. I was like, okay, maybe I'd let go. Maybe I let somebody else control this process. And I did, and it was horrible. And I'm not saying it's going to be horrible for everybody, but then you have to choose what kind of care do you want, right? And what kind of physician do you want? Are you the type of person? I'm not saying that if you give over control, that's what's going to happen to you. It's just like, what do you feel comfortable with, and how involved in the process do you want to be? And that could be an indication for you about whether this is the right doctor for you.
Yeah. I love that. It's interesting. One of the things that I've been talking about a lot recently, and I've got an episode coming up about it, is how, especially in the UK, we're very much in that frame of mind that we go somewhere and then we go to this person and they do things to us. And it's very rare that people are doing things with us. And I think what you've just described with the doctor who looked at that and said, okay, that information is important. And the doctor will like it because it's down in an app and it's got stuff to back it up. It's not you with a little notebook or you saying, menopause wasn't nice for me. It's more objective information that you're handing over, isn't it?
Yes.
I can see how that would really inspire that discussion, and that it is being done with you. Now, I have a lot of clients in the US, and it's a very, very different, the conversation is very different, because even if they have insurance that's giving them 5 cycles of IVF within their insurance, they're saying, well, I don't want to go that way. I want to look what else is available, before, if it's not been proved that that's definitely needed. What else is there? Whereas in this country, because of our system, I think we're very much like we're being made to wait for IVF. And it's like, why are they holding it back from me? And then you get there and you get into this machine almost. Not all clinics, but some certainly. And I like that I think it's empowering from the sound of it, and also it's informative.
So I can relate to both. I grew up in the States, and most of my my journey to getting to infertility, to that mark, was all done in the US, trying to take my endometriosis, taking 15 years to diagnose, having cervical cancer, having fibroids. All of those things happened in the US. And then I came to a socialist country where it's also very much like the NHS in the UK, where there's a system and you're put into that system, but it's very much a system that is pro women's health, which is why I moved here. They support 8 rounds of IVF. You do not have to wait. You can get your approval within 24 hours. Single women, any women up to 2 kids, you can get your support for that, which to me was amazing. But there is the going through the process and going through your local, not your local, but your health providers, actual hospital doctor, RE, or going private, and you can go to a private doctor and do it. And I went private myself because I'm really used to that coming from the US, right? So it was like this intersection of both for me, which I really hope more countries adapt. And again, is one of the missions. If you if you need a lower amount of treatments because we're able to have more success, then then it's going to cost more money, and hopefully insurance and doctors can work better together. But I think there is in the US, and I know that is my biggest market when it comes to the app, there's this big curiosity about what else. We're not as dependent as the UK is on the NHS, or Israel, for instance, is on its health system.
It's fascinating, isn't it, to compare that cross culture, and it's really marked to me now in the people that I'm working with across Europe and America and the UK as well. And we could talk for hours about this, and maybe that may be a subject for another day, Ravid, because it is key. Now, you mentioned there about all the different things you'd experienced moving through your endometriosis that took a long time to diagnose, the fibroids as well. And I always think that, I always say these are not diagnoses, these are symptoms of something that we need to travel further back to find, definitely. And that's really fascinating. Now, you have a baby now, is that right?
Yes, he's 10 weeks old.
Your baby, so this was at the last treatment that you
Yes, so it took, he's 10 weeks old. It took 6 IVF cycles to get here. He's actually, I was with a partner for 5 of those cycles. And then my 6th one I did alone with a donor, and we succeeded with the first one using donor. So he's now 10 weeks. It's a little boy. His name is Kobe, and he's the love of my life. He's amazing.
Oh, wonderful. And are you permanently based in Israel now?
I am, yes. I feel a great deal of debt to this country for giving me this gift. And so I don't see myself going back. And I think just everything is kind of slowed down in the world in the last year when it comes to everything we're dealing with COVID. And so we're just going to stay put and see what happens.
Yeah. And ultimately, something that sprung to mind there is you mentioned male factors earlier, and it's a big passion of mine that it's hugely overlooked. And so you had the cycles with your partner, and then you had donor sperm. Do you think more could have been done about that investigations for male factor previously?
Yes. So the male factor for us, I'm in a unique case because of the fact that I came in with so many pre-diagnosed things, and I tried to freeze my eggs, and I had a really bad cycle. And so moving forward, I was always the big focus. You have endometriosis, you have one functioning ovary, your egg quality is not that good, you're the focus. When my partner did have signals, he had like a 41% motility and 4% morphology, which is based on WHO, World Health Organization, is not normal actually. But it's being said that like it's borderline. And so because we were going straight into IVF, nobody really thought that we needed to investigate that because they were going to choose the best sperm from what he had anyway. And so it didn't really matter. I can tell you that after I got pregnant, he started going on changing some of his lifestyle choices, especially with his diet, and his morphology and his motility rate and his sperm count all got higher because of it, because it made him feel like maybe there was something that was happening with me. And so he went and got retested, and things were much better than when we were actually trying. So I definitely think there has something to do with it. I'm not denying the fact that like I'm a huge cluster mess of female infertility problems, but it takes 2 to make a baby.
And it's more than one thing. It's always more than one thing. Absolutely. And it does take 2. And I think for me, what I'm always talking about is, if you've got that low morphology, it's that what we want. I think we're talking about greater than 4, but doctors are looking at that saying, well, 4 is okay. It's at the lower end, but it's okay. But 50 years ago, 8 was acceptable, and we've moved that down. Like 30 million would have been better 30 years ago. But I think if the morphology is low, then that does give us an indication that perhaps we should be looking deeper at DNA fragmentation, which is very, very rarely looked at. And you don't need to do it with tests. You could just apply the principles. But again, that's a subject for another day, which I've talked about many times on here before. So back to Embie. I'm so so pleased for you with Kobe. It's just wondrous news. And I know that if people want to follow you on Instagram, you've got the Embie app account, so at Embie app, but there's also Embie 2 with the number 2 baby. And if people want to follow your story in more detail, then they can find that there. I will put those in the show notes. And also there's embieapp.com, which is your website where people can find out more about the app. How much does the app cost?
So we have a bunch of free parts to it. So to download it, it's for free. You can keep all of your medical records for free. The dates and results of your cycles are free, and appointments and support and resources. Those are all free. The part that we do charge for is to track the day-to-day of your protocols and to add medications. And that is, we have 3 different plans. If you just go with the monthly, it's $9.99 USD. I believe it's still $9.99 in the UK as well. And then we have a 3-month where you get 15% off, and then 30% off if you buy it for the year. And, unfortunately, if you are going through infertility, you're going to need it for the 3 months, because it takes your IVF cycle and then a transfer, and that normally takes around 3 months. But we've made it really competitively priced versus other systems that are out there for you. And, it's mostly just covering our costs at this point.
I think it's fascinating, and I wish you absolutely every success with that. And I know that for some people that this will be a really, really useful piece of information and an app that's available. And I am excited about that ability to share, both in terms of people sharing that with coaches like myself, but also, with the clinic, to have that all to hand and all in one place. I think that's really, really useful. Ravid, thank you so much for your time today.
Thank you for having me.
Love chatting with you, and we both managed to have that time to do the recording, which neither of us were sure would happen, was it? So no, that's fantastic. So thank you. It's been really, really lovely speaking.
Thank you for having me.
You've been listening to the Fertility Rewire podcast with me, Kat Stevens. If you wanted to find any further details, then you can check out the website, fertilityrewire.com, or find me on Instagram or Facebook or Pinterest at Fertility Rewire.